I knock on the door, the patient lets me enter, I do my hand hygiene, I'll introduce myself. Good morning, my name is Claudia, I'm going to be your student nurse for today. And for today's examination, we're going to be going over the heart and neck muscles. So for the first part, I'm just going to start off by asking 2 questions. For my first question, how many pillows do you sleep on at night?
1.
Just 1? Okay. Have you ever smoked? Do you ever smoke now or
No.
use any tobacco products?
No.
Okay. The next part, I'm going to lay the patient in a supine position with the head at least 45 degrees of an angle. And I'm going to turn his head to the left side because we're going to be inspecting our jugular veins. We're going to be inspecting for any distension, which is abnormal. So as we can see, my patient's jugular veins are nice and flat. If our veins are distended, that could mean an increase in venous pressure. So again, that would be abnormal. For the next part here, I am going to palpate my carotid pulses and I'm going to locate them. They're just right next to the trachea. So I'm just going to be palpating for the contour and strength. And my contour is nice and smooth, and the strength is normal, about +2. It's not bounding and it's not weak either. So after that, I'm going to auscultate the carotid artery. I'm going to be listening for a brute sound, which makes like a swishing sound. So I'm going to be listening with the bell of my stethoscope. So again, and for this part, I'm gonna have the patient breathe in, out, and hold it when you breathe out. And you can be sitting up for this portion. So breathe in, out, and hold it. Okay, and then again, breathe in, out, and hold it. Okay, so now we auscultated the carotid artery. No presence of brute heard, so no swishing. I was just able to hear the pulse itself on both sides. After we're done with that, we're going to move on to the precardium of the chest. So first I'm going to inspect and make sure that there's no abnormal palpations or bulging, which there isn't. My patient's respiratory rate is normal, the rhythm is regular. I'm going to go ahead and locate the maximal point of impulse, which is also the apical pulse. That's going to be at the mid clavicular line and at the 5th intercostal space. But most of the time we can't feel it, so I'm just going to go ahead and listen and make sure that it's nice and regular. Okay, and rhythm is nice and regular. Next, I'm going to auscultate my 4 valve areas. So the first part is going to be on the right side of the sternum. That's going to be our aortic, so I'm just going to listen to that. And we're going to be listening to this part of the assessment with our bells of the stethoscope. So we're going over aortic. I'm listening for my S1 and S2 sounds. I'm listening for any murmurs. I'm listening for any extra heart sounds. Then we're going to move over to the left side of the sternum, and that's going to be our pulmonic area. And again, I'm just listening for anything abnormal. After that, we're going to go down to the 5th intercostal space next to the sternum, and that is our tricuspid valve. And then we're going to move down to the apex of the heart again, or we're going to move down to the mitral valve, which is again located in the fifth intercostal space of the midclavicular line. Okay, and again, I was able to identify my S1 and S2 sounds. There were no additional heart sounds. There were no murmurs. And after this, I'm going to go over that same assessment in the 4 valve areas, but this time I'm going to do it with the diaphragm of my stethoscope. And again, I'm going to go over the same 4 areas, just with a different part now. Again, looking for that S1 and S2. We're going to our pulmonic area now. Then we go to the tricuspid. And the mitral. And again, I was able to identify my S1, my S2. There were no extra heart sounds identified, and there was no presence of heart murmurs. And that concludes my assessment of the neck and heart valves. I hope you enjoyed it. Thank you.